instead of having a round belly button, it looks more like a sad line or a frown, basically the fold of the skin over it. And when you're like standing on the side view, you see more fullness in the upper abdomen because of that skin laxity than the lower part. Those are the perfect candidates for this procedure, okay? And I'll explain why. But basically, you don't have any skin laxity below your belly button, okay? Your belly button is in the position that we want it to, and you don't have any muscle laxity, okay? Or diastasis or separation of the muscles. So who's again the right candidate? Only skin laxity above the belly button. So where is the incision? Hidden below the breast. So if you had a breast lift with a scar in the lower part of the breast, is basically that same scar. So you won't have any other scars, just there hidden below the breast. If it connects in the middle or not, it's going to depend on the amount of skin laxity that you have, okay? So connecting it in the middle, it's gonna get a pull right where you see this middle arrow here. If we just do below the breast on each side, but not in the middle, you'll get a pull on the sides and an improvement in the center of your abdomen. But to get a dramatic pull in the center, then we'll need to connect that scar in the center. I know a lot of people tell me then, and it's a conversation that I have with the patients, how aggressive do you want that pull? Do you want a more subtle pull, but avoiding that scar in the middle is something we can discuss, and sometimes you're a good candidate for that. And I've done that for a few patients. But a lot of patients are like, no, I just want it to be as tight as possible and get rid of that hooded belly button. Then sometimes we need to connect it. And this is basically how the skin excision looks. It's basically like a wedge of the skin up here, and this is what's removed and then tightened up, okay? In this case, we don't do muscle repair, okay? No muscle repair. Why? Because the incision is only up here, and it's impossible to do a muscle repair from the top because there's no visibility of the muscle, okay? To do a muscle repair, we have to open in the lower part of the abdomen, elevate all the skin, and then do the muscle repair. So there's no muscle repair, but because there is no muscle repair, there's no elevation of the skin, we can do more liposuction, okay? We can do liposuction in the entire abdomen, okay? So it is a good combination to do, which is lipo 180 of the entire abdomen, waist area, above and below the belly button, and then excision of the skin and pulling that skin in the upper part. And I'll show you some before and afters that basically depict and show how the entire liposuction of the abdomen gets a very good contour, and then pulling of that skin gets rid of that hooding of the belly button above the belly button. The other good thing is no drains. So because we're not elevating all that skin to do the muscle repair, we don't have to put any drains. If we're doing a lipo 180, lipo of the entire abdomen, then I may put one drain only for 5 days, like a liposuction or BBL procedure, and then remove it on day 5, okay? So Willie, can you help me out giving me the before and after there, so I can show you guys these 2 cases that basically you can see, and this is the before, how she had loose skin here. So people, and she had like this.
There, yes.
Okay.
I'm going in, zoom.
So you can see this areas here that bother her a lot. And that sometimes will say, oh, I had liposuction and got some fat there that wasn't pulled out. It's not fat, it's skin laxity. When we have skin laxity and the belly button is a fixed point, it kind of folds the skin and you see this pattern here, okay? And you can see after how the belly button now looks round. The incision is up here below the breast, hidden below the breast, and you don't see any of those irregularities, okay? In her case, it was only the reverse tummy tuck, and I didn't need to do any liposuction. In this patient here, she had lipo previously, similar case, and you see all those irregularities. Some people think is irregularities from the liposuction, but it's really skin laxity, and you can see the belly button hooding which is like it looks sad, that skin over it, hooding over, and she had some fat down here that she wanted to improve, and also the waist improve. So we did, in her case, liposuction of the entire abdomen with the reverse tummy tuck, and you can see how the appearance of the skin looks flatter, tighter. I did liposuction of the entire abdomen. You see definition of her waistline more, and the incision hidden up here. No incisions in the belly button, no incisions in below the abdomen, no incisions in the sides here or anything, just pulling it up. And you can see here on the side view how that belly button hooding improved, and I'll show you, but you can see all this folds of skin. It's kind of skin laxity over it, all of this as well, and how flat we were able to achieve the abdomen by just pulling it up, incision up here, no incisions in the belly button, no incisions down here, and flatness of her belly. She was a great candidate because she didn't have diastasis or separation of her recti muscle. I had a good question about the muscle separation and how am I going to be able to know if I have muscle separation or not? One of the things that you can do is pinching your abdomen. So if you have a pregnant look belly, or like a very bloated, that you look like you're pregnant, and you pinch your skin and it's very thin, that's mainly muscle separation. Also, when you palpate yourself, you palpate the muscles and also a gap or a depression in the center. So basically, if I am drawing the muscles here, the belly button in the center, we have the six-pack muscles right next to each other. With the pregnancy, this muscle separates like this, and when you palpate, you feel a softening or it's not a hole, but something that is softer in the center, and that's a muscle separation, okay? So those two things help. Of course, going to an evaluation and being examined by a surgeon is the best way of knowing, but those things can let you know at home if it's more visceral fat, muscle laxity, or actually subcutaneous fat. The pinch test, if you pinch yourself and it's very thick, and it's not, and basically when you lay down, it's mainly like thickness of the skin, then that's not muscle laxity, it's most subcutaneous fat, okay? So no muscle repair with the reverse tummy tuck, but in a patient that is a good candidate, you can achieve flattening of the belly, getting rid of those irregularities that form a skin laxity, but doing it in a way that the scar can be easily hideable in places that you may have scars already, like a breast lift scar. In both of these cases, I did a combination of a breast lift and the reverse tummy tuck. So it is a possibility of doing a type of mommy makeover, but with a reverse tummy tuck instead of a regular tummy tuck, doing the breast and the reverse tummy tuck scar, okay?
I have a name for that.
Okay.
The reverse mommy makeover.
Okay, let's go. Reverse it, okay? And those are the benefits. What it also very, very important, the massages, okay? Because we do more liposuction in these cases, the massages afterwards are more and more important, okay? The other thing is we don't need to wear a binder. We can switch to a faja right away because we're not doing drains and we're not doing the muscle repair. So things that are, the recovery is a little bit more similar to liposuction than a tummy tuck because of the reason that we're not doing muscle repair, so we're not elevating the entire skin. Those are the things that we need to be concerned of when we're doing the tummy tuck. And the other thing is the drains. There are no drains, so there's no like drains on the sides. It's only one if we're doing lipo 180. I'll take some questions now if you guys have them.
We have
Yes, let's go.
Okay, this is like in a random order, okay? Can you combine any other procedure with a facelift, and if so, which ones?
Facelift. Okay, let's go into facelift surgery. The procedures that we combine with facelift are tailored to the face. Okay, so one of the things that I am very critical when I'm combining procedures is the length of surgery. A facelift procedure is a lengthy procedure because it's not because it's a large area, because it's a very meticulous surgery that takes time. Okay, so surgery itself with a facelift is 4 to 5 hours. So what procedures we can combine that safely? I'm not in the OR for more than 6 hours. Blepharoplasty, eyelid surgery, it's a very good procedure to combine. We can combine fat transfer to the face, okay? We can combine brow lift, okay? All of those. Rhinoplasty, I don't combine with facelift because rhinoplasty is another separate procedure that is very meticulous, is very time consuming. So if I'm combining a facelift with a rhinoplasty, it's just gonna be too long. Under anesthesia, too many risks, okay? But the majority is fat transfer to the face, blepharoplasty, also earlobe repair, and upper lip lift.
Okay, let's keep talking about facelift.
Yes.
How's the recovery and who's a good candidate? How many days need to be in Florida?
I ask you to be 1 week in Florida after the surgery, okay? So I'm gonna see you the day before the surgery, and I still see you post-op day 7, okay? So facelift is the only surgery in rhinoplasty. It's the only facial procedures, that I ask you to stay until post-op day 7. So a little bit longer than mommy makeovers, lipo, and other procedures. How's the recovery for facelift? You're gonna have one drain in the neck area for the first 1 to 2 days. So I'm gonna see you in the office day 1, day 2. I see you more often, okay? After I remove the drain from the neck, then it's usually just applying antibiotic ointment to the incisions. It's not a very painful surgery. You're gonna feel very well, but you're not gonna look great, okay? So the first 1 to 2 weeks are gonna be very swollen, bruised. You may feel even tight because it's so swollen. So the first 2 weeks, it's when the recovery, you're gonna need to be more calm at home, not doing anything strenuous. Majority of patients are back to work at 3 weeks. You may put makeup. You're good to go outside with makeup by 3 weeks. Your red carpet ready by 3 months. So if you're planning a big event, a lot of my facelift patients are planning a wedding or something big that it's like graduation of a son, something that is big that they want to go. Plan to have the surgery at least 6 months before, so you're ready for the event.
Okay. Who qualifies for a reverse tummy tuck?
So who's a good candidate? People that only have excess skin above the belly button, okay? If you have excess skin below the belly button, you're not a good candidate because it's not gonna improve much. It's better to get a regular tummy tuck because I elevate the entire skin, I pull it down, so you're gonna have a better result. And no muscle separation or diastasis. This is not targeted with a reverse tummy tuck.
What precautions do you recommend for stellar results post-surgery?
So the post-op is as important as the surgery itself. So all my post-op recommendations are stellar because they're so important. Compression, massages, walking, hydration. We can do an entire Tuesday tips about post-op care, and we can do it next week. But all of those things are extremely important. Being very meticulous with your wound care afterwards to try to avoid infection. No submersion in water. There's a lot of details, but we can go into detail in another Tuesday tips because I can go talking about this for 30 minutes.
The scar, is it invisible once healed?
So everybody's scars differently, right? Like I try to make my scars in a place that is easily hideable, in a bikini, in a low cut, in the bra line area, right? Areas that we can easily hideable in clothes, and my surgical technique is very meticulous in terms of trying to avoid tension and the cutting and try to make that line as straight, as fine as possible. But genetics plays a big role in scarring, okay? So patients that are prone to hypertrophic scar, keloid formation, the area of the body, we can have a scar heal beautifully in the breast and then have a scar very wide and thick in the back. The skin texture, thickness is different in different parts of the body, okay? So what are the things that I do? Like I mentioned, my surgical technique, placement, scar products afterwards, avoiding sun exposure, avoiding tension. All of those things are going to have a better outcome on your scar. With years, the scars tend to get better and better. After scars tend to take up to 1 year to mature. So you can't really assess a scar at 6 weeks, 8 weeks, because the scar is going to continue to mature. And when I say mature, it's going to continue to get thinner and lighter, okay? But you have to continue your post-op care routine to get that scar to where we want it, which is as invisible as possible.
The reverse tummy tuck is it as painful as a regular tummy tuck, and do you typically lipo as well as lift the skin?
Yeah, so it is not, because majority of the pain associated to regular tummy tuck is the muscle repair. The skin excision is not very painful. So this one is not as painful, but I'm still gonna ask you to be hunched over to prevent tension on the scar. Okay, so that part we still have to do. And like I mentioned with this one, because I'm not elevating the skin to do a muscle repair, I can be more aggressive with the liposuction, and I can do a liposuction of the entire abdomen, okay? So that helps a lot with contouring, and then I can tighten the skin more because everything is thinned down.
Is there a possibility of loose skin on the side boob area?
So there is sometimes that I have to extend, and Willie, if you can show me the after of the second picture,
Yes.
you can see that I extended it a little bit past where the side of the breast finished to try to avoid that. If you do have skin laxity that extends more, then you can have that scar extend laterally a little bit more to get rid of that skin there. Thank you, Willie.
Okay.
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 Good question.
Why so uncommon? I can't find much info.
Yeah, that is true. It is uncommon because it's a procedure that it doesn't target the majority of the population. The majority of the population have excess skin down here and muscle separation from weight loss and pregnancies. Those are the two most common things, and the vast majority of patients will have muscle laxity and skin laxity below the belly button. So the majority of patients are not a good candidate for this. I think that liposuction has become more and more popular, and more people are getting liposuction, and the majority of the cases, I think all of the cases that I do with reverse tummy tucks are patients that had prior liposuction, got a good retraction of the skin down here, but because of the belly button fixed point, they see the laxity above the belly button.
If you get pregnant after getting a reverse tummy tuck, does the scar widen?
It may. So that's one thing to consider. Anything that applies tension to a scar may cause the scar to widen. Again, having a pregnancy after a tummy tuck, either a regular or a reverse tummy tuck, may have effects on the scar, effects on the muscle, effects on the skin laxity, and you may need a revision, either if it's a reverse or a regular. That's the reality.
Okay, if I get a tummy tuck and I have loose skin on the side, can it be extended?
In the like dog ears, on the sides of the incision. So yes, so when we do a tummy tuck, basically we have the little bones here and here that you can see when you're laying down. The extent of the incision goes up to the bones. But if you have skin laxity extending to that point, then we may extend the scar, and that's what's called an extended tummy tuck. So yeah, we can do that.
Okay. And the last about the tummy tuck is, with the reverse tummy tuck, do you also repair the muscles, the corset?
No, so unfortunately, there's no visibility to do a muscle repair with the incision up here. I'll have to do a scar down in the belly in order to do a muscle repair. It's not physically possible to do it upside down from the top down. So, and it's not safe to do it because you don't visualize the blood vessels. I can end up having problems. So in order to do a muscle repair, the incision needs to be below in the abdomen. From up here, it's just skin excision, and it can be combined with liposuction. Okay, guys, thank you. Thank you so much for all the questions. I know this is a new topic, like you guys mentioned, and it's, I think with more and more patients getting liposuction early on and then getting pregnancies, we're gonna start to see more and more patients that are candidates for this. So I hope this helped answer the majority of the questions. If you have more questions on the topic, please drop them below in the comments and I'll get to answer them. And thank you so much for joining. Next week, I have the topic already. We're going to be talking about post-op care. So bring your questions and I'll see you guys next week. Oh, and Willie asked me to remind you guys that we're still running our giveaway of a beautiful, pure, what, we have it?
Yeah, we have it. Just turn around. Just turn around, Arturito.
Oh my
Gíralo.
God.
Yes, we're ready.
Ta-da! We have our beautiful pure beach bag. So if you send us a before and after in the beach, we're gonna send you a pure bag.
Yay!
So send us your pictures and you get one of these. I was at the beach this weekend and sorry really I didn't take any pictures, but I used it and it's so good, very convenient. So I'll see you guys next Tuesday. Take care.